Hi, everybody. Welcome. This is Dr. Izabella Wentz, PharmD. I'm really excited to have our special guest today, Dr. Marc Bonner, with us today. I found out about Dr. Bonner's work a few months ago, and I've just been so excited to have him on. We're going to be talking about periodontitis, and if you've been following my work, then you'll know that periodontitis is very much connected with Hashimoto's, and people with Hashimoto's will have oftentimes periodontitis. What I found is whenever people have exacerbations in their Hashimoto's, they often will have increased gum inflammation. And we'll see that the gum inflammation reduces when people have downregulation of their Hashimoto's. And Dr. Marc Bonner is specializing in periodontitis, and he's made some really amazing cutting edge discoveries that we're going to be discussing during our interview today. Let me share his bio with you. So he is a dental surgeon. He specializes in gum disease treatment, is a member of the American Academy of Periodontology, and is the founder of the International Institute of Periodontology. His website is www.periodontite.com. That's spelled P-A-R-O-D-O-N-T-I-T-E. He's the founder of the Association of Médicale contre les Infections Buccales. That's in France. So he is French-Canadian. He has a certificate in medical biology as well as a doctorate in dental medicine from the University of Montreal in Quebec. Dr. Bonner has quite a few publications. One of them is the detection of the amoeba, Entamoeba gingivalis in periodontal pockets, medical implications of oral amoebobiasis, and tropical medicine and international health. He also has a publication on the observation of trichomonas infection in a child with periodontitis by direct microscopy of the dental office. Entamoeba gingivalis is a pathogen that's similar to Entamoeba histolytica, which we know can trigger intestinal permeability and some autoimmune disease. And it's a very key aggressive predictor of periodontal disease. So Dr. Bonner has found that he actually sees patients who eventually will end up having, through his protocols of eliminating the protozoal pathogens, he'll see that there's a cure rate with periodontal disease rather than just suppression as we've seen with other types of interventions such as antibiotics. Dr. Bonner has a few books out. One of them, the book is called To Kiss or Not to Kiss, A Cure for Gum Disease, that you can pick up on Amazon. And the book is also available in French and in Spanish. And I'm not going to try to pronounce the titles here because I would butcher them. And so welcome, Dr. Bonner. I'm so excited to have you here with us.
It's a big pleasure for me to see you, Isabella, and participate to this wonderful health advancement, I believe. Yes.
Yeah, super excited. Wonderful. So let's start off for people who are maybe not familiar with what periodontal disease is. Can you explain, to a person that's just wondering if they might have this or not, what it would look like?
Periodontal disease is very common. I mean, it touches about 65% of adults worldwide. So we can say that half adult people have this disease, and periodontal disease is an infection. Usually it starts with what we call gingivitis, which is like reversible, which is bleeding gum. It's caused by bacteria, too much dental plaque, and then you have this little disease of the gum, but it's reversible. But if you let this go, then you get what is more bone disease, which is periodontal disease, which attacks the bones, and then the bone just resorb, and slowly you have tooth moving, more bleeding of the gums, and finally you lose your teeth. And this process can be sometimes very aggressive and rapid on 2 or 3 years. Sometimes, most of the time, it can take 20 years to have, to lose your teeth. But it's a very important disease, and usually dentists, they try many things, but I don't see generally good result in the treatment. So this is why I came up with this microscope thing and protozoan thing in this disease.
Wow.
So,
And so with somebody who has bleeding of the gums, would that be an early sign that they might have this?
yes, of course, it is the first sign we can see. And if you have gum bleeding, you might think it's not important, but really it is important. If the first thing, if you have, like your ear would be bleeding or nose bleeding, you do something. And gum bleeding is not normal. So you have to do something. You have to see your dentist. So now how could your dentist treat this so that you can be cured? I mean, gingivitis can be cured very easily. This is not a big problem. But when the bone is touched, this is more complicated thing. But the nice thing is I say we can cure this disease now. So this is fantastic that we can, explain this to people, to public.
That's very exciting. And bleeding gums are very common, but that does not mean that they're normal. So if any of you guys at home have bleeding gums, then this is something that may be very, very relevant to you. So what I found when I was researching just different things about Hashimoto's is I found a few articles that were published a few years back about the connection with periodontitis and Hashimoto's. And I believe there are 2 different articles that have made that connection now. So, Dr. Bonner, how do you find that periodontitis relates to Hashimoto's or chronic disease in general?
In fact, when I've looked at studies about Hashimoto's and periodontal disease, I really find something like aggressive periodontitis. So maybe in this particular thyroid disease, it can be more aggressive for the periodontitis. But all cases of periodontitis we've been treating or we see, we always find those parasites being in the dental plaque within the gum sulcus. And periodontal disease is related to maybe 10, 20 or 30 diseases really that we know for years. And those include heart disease, rheumatoid arthritis disease, premature baby with low weight for women, and lung disease. And also thyroid disease, we know maybe a little less, but we know a lot about cardiac disease and all this. So I believe having this permanent infection in the case of Hashimoto's disease is really not a good thing to keep. So I would encourage people with Hashimoto's disease to be treated for the gum problem and bone problem, to be treated properly so they can be really cured and have the best result with their, consequent disease related to this.
And I think that makes a lot of sense. So looking at the research in autoimmunity, they found that you need to have the right genes, the right trigger, which is sometimes an infection, and then intestinal permeability or a leaky gut so that your immune system doesn't develop properly for autoimmune disease to manifest. And what's been found is if you take away the triggers or the infection or the intestinal permeability, you can get a remission of the condition. So I've been able to, figure out for some of my clients and for myself, what are the triggers, what's causing, the flare up of the immune system or what's causing the intestinal permeability, and you eliminate that factor and the person could get into remission. So, protozoal parasites, we found them a lot in the gut of people with Hashimoto's. And whenever we treat the protozoa, we see that the person's antibodies reduce, their symptoms reduce, they feel better. Sometimes they can reduce their medications. And so, we say that all disease starts in the gut, but the gut actually starts in the mouth.
Yes. This is the first place where we see the parasites, in fact. So there's been a lot of work with the parasite, the amoeba, Entamoeba histolytica, but what we find in the mouth almost all the time is the amoeba Entamoeba gingivalis, but it's fairly the little cousin of histolytica that creates a lot of problems. But we can see with the microscope work we do, we can see clearly with patient how those, if those amoeba are present, if they are present, and we can see how they relate to the host, and we can see really actually what they cause to the immune system. But I mean, looking at it clearly into the microscope, we see the disintegration of white cells, immune cells, and this, we can see this every day with so many patients, and patients can see this also with our technique, so they can just look at the screen television adapted to the microscope. And most patients with periodontal disease, when they see this for the first time, they cannot believe they have those parasites living into their gum and causing this problem to their immune system. So it is very visual, it's also scientific because you really can see this. And all patients cured, we remove those parasites and then everything goes fine and just bone just grows back again. So it's really evident not to keep those parasites. And there are two parasites, in fact. Most of the time it's Entamoeba gingivalis, and some of the times you have a second parasite, which is Trichomonas, which the name is Trichomonas tenax. And when you have both parasites, it literally is worse. You have big problem with taste and everything. So it's really easy to look, and it's very surprising for the patient the first time when they look at this, because it's very active into the gum and you can see it clearly.
Wow, that's amazing. And then do you think, the close position to the mouth of periodontal disease has an effect with maybe Hashimoto's in the gut?
Really, what you tell me now is I really would be very think there might be a question with the proximity, because the mouth is just close to there and you have all those circulating area. And we know that the amoeba from histolytica problem, the amoeba goes into the bloodstream because it goes to the liver. So no studies have been done with the amoeba from the mouth, but usually it has about the same habits than that histolytica. So I think like one big question would be about giant cell. I was talking to you because amoeba just look like giant cell. They nourish from the white cell nucleus. So when we look at an amoeba, it's like it's a giant cell having 5, 10, and sometimes 20 nucleus inside their body. So they really look like a giant cell. And I remember, I think a giant cell might be related to thyroid disease also. So there are many, many, many things that can be done in the research. But first, it's just expressing this to patients that don't know. Most patients with periodontal disease and Hashimoto's people, if they have this periodontal disease, have to know they have parasites into their gum. Those parasites cause a lot of problem to their immune system.
Mm-hmm.
Don't know if yeah.
That makes a lot of sense. And so I know that in the past, and this is something that I wrote about in my first book before I found out about your research, antibacterial recommendations were made for periodontitis, such as using a low-dose doxycycline or antibacterial interventions. But you recommend antiparasitic. Can you explain the difference and the rates and success?
Yes. If I can explain to you, it's like in most area, school, universities, everywhere, everybody says periodontal problem is a bacterial disease. In fact, what we have found for more than 30 years with Trevor Lyons, it was the first dentist in Canada working with this, and we found that when you have bacteria, in fact, you have gingivitis.
Mm-hmm.
Gingivitis is reversible. You just have to remove the bacteria, brush your teeth, do the floss, and everything's fine. But in the real periodontal disease, we always find those parasites. So treating those parasites is the key to curing periodontal disease. So we've been working with many, many products that have a tendency to remove those amoebas. So anything that would remove parasites, amoebas, would be good for any patient. So there are really little things, complicated creams, and then we go to metronidazole, flagyl would be the last product we use. But we try to go slowly with the patient. In general, when we treat a patient, the first step is remove the infection. Then we care about the bone problem or calculus problem or not having this disease again. We explain how to understand the disease. But the first thing is really remove those parasites. And parasite drug, actually the best parasite drug actually really is metronidazole. And it's been demonstrated that you do not have, uh, metronidazole is still effective with the parasite. So you don't have the same problem with bacteria because they cannot recognize the molecule. So you still have very, very, very good result with the metronidazole drug to treat this disease.
Okay.
Doxycycline or other antibiotic can be useful, but really metronidazole seems to be the most effective one.
Mm-hmm. You know, metronidazole is an oldie but goodie. So it's an old medication, but it still works very effectively. One thing that people don't want to do is they don't want to drink alcohol when they're on it.
Yeah, that's a problem. But you know, if I can tell you how we start to cure the disease, this infection, you may be surprised if you know or not. Usually we use, hydrogen peroxide to brush teeth and gum, and we dilute it. So it does remove some parasite because they don't like this oxygen thing. And the second very effective treatment, but it could be for not a real big disease, but if you're getting the disease first, you can use this powder we call Torrance powder. It's sodium bicarbonate, 1/6 portion for 1 part of salt. So you don't drink it. You just brush, you just tap on your gum, and this salt will really make the parasite explode. So when we start this treatment, patient first month, he uses this hydrogen peroxide, diluted 1%, and apply this salted powder. And you can see the parasite are killed on the microscope. So when we take the sample 1 month or 2 months or 3 months after, we see the dead parasite. So it really is an effective method without going to metronidazole. And sometimes for the beginning case, you can, be treated for this and you don't need a metronidazole. Metronidazole we'll use when you have deep disease and we cannot get rid by other method.
Mm-hmm.
But
and what I like about your method is, with doxycycline, it's something you have to take long term, and it doesn't cure it. It just may suppress it in some cases, but it doesn't cure it. Where your method actually cures the periodontitis.
Yeah, the good thing I would tell you about this thing is the microscope. I mean, this microscope, you can take a sample of the plaque, dental plaque. It is easy to do. It takes 3 minutes. There is no pain to it. And we just put it on the microscope, and there we can see the problem actually just live. We see the living white cell, we see the living parasites, the living bacteria, because they live together, bacteria and parasite. But the thing is, the microscope really is a major important for curing the disease, because we can see when you have no more parasite. We can see when you have no more white cells. You can see if you have neutrophil if you have macrophage coming in, so they start curing for the bone. So everything we can see with the patient, measure it until we are back to what we call common cell flora, normal flora. And we know how people are when they have normal flora. We know we see the bacteria with gingivitis, and then starts the neutrophil, no white cell coming in, inflammation is there, and then we see the parasite at the end of this process, and we can do the work back with this microscope. Usually we see the patient every month until they get better. Usually it takes about 1 year to be treated. In fact, maybe once a month I see the patient. But progressively, first month, second month patient, they see no more bleeding. Wow, no more taste problem. You see, everything is getting nicer and nicer and nicer, and we can confirm. Usually, I like to make sure at the 5th month of the treatment, there's no more parasite, neither pathogen bacteria, and having a lot less neutrophil or no more neutrophil expressing the inflammation. So we can really manage with this microscope. It's just sad that university and dentists have removed this marvelous apparatus that we have from dental school. There's not much in dental school, but I really want to have this microscope back everywhere onto this planet, so the dentist can make a look and inform the patient about this infection.
So you're right, because basically, if you come into a dentist office, most of the time they're not going to take your your samples and put it under a microscope, so they don't really know what's going on in there. So you've actually done that, but this is
they would take measurement to see that you have the disease, and they try to get rid of the disease. But as they work only on the bacterial disease, they don't have much success. So big success I see is 20% cure, a big success 50% cure, and this is not, this is not enough. We really need to have 100% cure, because if you're half infected, you reduce bleeding half. This is what is done usually. It's not enough. So what we need is no more bleeding, because the bleeding is the first nourishment to those parasites. This is the, how do you say, portal of entry. This is where the parasite go into your gum, because you have bleeding gum. Because the parasite, the amoeba, nourishes from the white cell and nourishes from the red cell. They take the iron from the red cell and they take the protein from the nucleus of the white cell. So having bleeding gum is, the worst thing to first. And then understanding that secondary, you have the parasite coming in to get this nourishment from your body, as a vampire parasite, they eat your blood. So this is not normal. And I would believe this is maybe worse with Hashimoto's. I mean, do not keep those parasites into your body or your gum. This really is nonsense, medical nonsense, I used to say.
Absolutely. And people with Hashimoto's will often have very low iron stores. So you measure the ferritin and it's very low. And one of the reasons for low ferritin is when you have a parasitic infection or another type of infection that feeds on your iron. So you can be eating a really good diet, but you're just, you're not feeding yourself, you're feeding the parasites that way.
It's sure amoebas have, I don't remember, but they have 6 or 7 ways that they can get some iron from your body. So this is really, I call this aggressive predator, okay, that lives from your iron. It has to feed, and actually it is worse because, like I used to say, it's like living cell. So it does walk into the down your gum. It goes like this, and then it eats your cell. You see it, and then it sleeps like having good meal. And then they do babies. So we can do the amoeba separating and having babies. And the more of this activity you have into your gum, the worse and the more aggressive is the disease. So it is really clear that we can see this, and we know this for more than 100 years ago, but it's just sadly dentists have forgotten about this microscope and taking a sample. It gives us so much about the disease and how active it is. Because if you have antibiotic for any reason, your periodontal disease will slow down. And then after 3 or 4 months, it comes back again, because you have to learn how not to how to prevent the disease. You have things you have to do to not get the disease again. And patients have to understand this, how it happens. It's very important into the curing process or healing.
Absolutely. And let's just back up a little bit. What is the traditional approach for treating periodontitis, which is based on the theory that it's bacterial? So what is, we talked about the cure rates not being very good, but what do they actually do for people?
I'd say sadly, first thing is brush your teeth, floss, and everything. Okay, that's okay.
Yes.
But when you go to the dentist, the first thing they use to look at is curettage, curettage of the gum. So curettage of the gum is like to remove the bad things. But curettage of the gum is it's like a barbaric thing. It's it creates blood. It gets more blood to the parasites and bacteria. You may remove some, but doing this is not appropriate, I would say. And second thing is you try to remove bacteria, but bacteria, it's very difficult because you don't know if it's done or not, because you have to do testing, DNA test for the bacteria that are very expensive, and you have to do 1, 2, 3, 10 tests. And this is very expensive, and dentists, they don't do it. And it just brings you with, like a sheet of paper, and then you have this bacteria and this bacteria. It's not really visual. But when you look into the microscope, you see this very clearly. So usual treatment to me is curettage, surfaçage, which is, scraping the root. And scraping the root for me is the worst thing to do, because you have a little cement thing on the root, and you have to keep this cement so you have reattachment of the gum to the root of the tooth. So curettage, surfaçage, all those things, I think we go on the wrong way. And this is what is usually done at the dentist. But result is not good either. And then when after 5 years or 10 years, you see that the result is not there comes the surgery. So you remove part of the gum, remove part of the bone. So it's all negative for the maxillary. What we want is have more bone and no infection. So actually, I think it's really bad story about periodontitis, because most dentists would say it is chronic. You keep it for your life, and sometime during your life you lose your teeth. So I just want to say that's not true. It's just you have to do something, and something can be done, but I think we have to use the microscope, I would say, in the same manner as, for dental cavity, we use the X-ray to see a little thing. So the microscope gives us the same thing. When we see the beginning of the disease, we see when it stops, we see when it's cured with the microscope. So our thing is really different with this microscope, but I think it really makes the difference with usual treatment, which is, just stabilizing the disease, but we still have it. So what we want is not having it anymore. So this is what we want.
What you're really doing is getting to the root cause of the condition, where, a lot of the traditional dental approaches are just trying to suppress symptoms and using surgery. And the same is happening for thyroid, conditions where people are giving more thyroid medication, sometimes they recommend removing the thyroid surgically when things don't go as well, where a lot of times the infections could be the underlying root cause. So that's really, really great. Your book is called To Kiss or Not to Kiss. So
Yes.
there's a good reason for that. Can you tell us how people contract periodontal disease and, why
Yes.
some of us might have this?
Yes, of course. Like I said, it all starts with gingivitis, okay? And gingivitis, then you have this blood into your gum, and then from some reason, somewhere around you, there are those amoeba, there are those parasite or trichomonas or entamoeba. Most first thing I would say to patient is, half adult have this disease. So when you kiss your husband, if your husband or spouse, or anybody you kiss, you can contract and you can get those parasites. So you have to know this. If you have gum disease, I mean gingivitis, which is the opening of this process, then you contract the amoeba, then it gets into your gum and it creates the problem. So you have to know where it comes from. You have to look around you. So the first place is the family. Usually dentists speak about genes, but it's not that gene, but it's more like the family. And the things we use, like the drinking, we have my drink, drink in my bottle, and here's my spoon, and have my lipstick, and have my cigarette. So patients, they have to understand about this. And the second thing, the most important thing, also secondarily, I think, is water. Tropical water, because when you go into in the tropic, there are lots of parasite amoebas in the water. There are maybe 30 kind of amoebas, but you get into this holiday vacation for 2 weeks, and you have this water infected with parasite that gets into the nice fruit and vegetable you want to eat, for good for your health, and they are infected with this water. So the second thing really is watch for holidays, watch for water, have to drink bottled water in those area, and watch for, you just have your bath, with opening your mouth during the shower, things like this. It's the second thing. And I think one of the most third important thing that nobody really talks about is those pets we have. Those dogs and cats. But
Once.
most dogs, after 3 years old, they have the same periodontal disease as humans.
Really?
Yes, absolutely. It's the same thing. You see the dog at 10 years old with the moving teeth, he's losing teeth, and many dogs have amoebas and trichomonas, okay? And both together is more aggressive disease. And how many times I see, mommy taking a little food for the dog and a little food for her, and it goes like this in the summer with the little cube of ice to the dog and putting your licking your fingers. So, the little dog coming in, jumping into the bed in the morning and say, what, see what he's doing. So this is very important thing to do. Watch for the family, what we share, water, pets, and I would give you the fourth most important thing is, you know what? The best thing is never have this gingivitis first. If you don't have this gingivitis first, then you cannot contract the parasite because they just go on, digested, and they go away. The problem is you have this open door, which is gingivitis, and then you get those parasites from any place. So when patients go like vacation holiday in the Caribbean or a tropical area, we give them things to do. So when they go there, they have to do the hydrogen peroxide, their salted paste. And sometimes alcohol, like 40% alcohol, would kill parasites. So I say, take the tequila when you're on holiday. That's okay. And you know, Mexican people, they take tequila, lemon, and salt. And you know, those three are parasite killers. So sometimes when you think of this, it's for holidays. But some people, you have to, do normal thing and holiday and prevent the disease also. So it's important you understand how it comes. And many, many times I see one person from the family, and then comes the husband or wife 3 or 4 months later because they don't want to, contract this disease really.
Back and forth. Yeah, that's really great advice. There's a saying, I'm from Poland, and there's a saying that says, Kto pije I pali, ten nie ma robali, and this means he who drinks and smokes doesn't get worms. And so, that's good advice when you're on vacation, is to make sure that you're keeping your your mouth clean, and alcohol can definitely be a great disinfectant. So if you guys are looking for a reason to drink tequila,
that's for the holidays. That's for the holidays. That's okay.
Yeah.
But I see young people, they have a lot of, it's direct and indirect contact. So I see some young, adolescents that have the disease, even who have young children, 6 years old, they get the disease from their parents. And, it's important that you understand this. When you understand this, then things are much easier, so you don't contract this disease again.
Mm-hmm. Absolutely. So let's get into, we talked a little bit about your protocol. If you can give people like a outline of it, and I know we'll have some dentists that are not familiar with this, and then a lot of patients will go to their dentists and ask about this after watching this. So can you give an outline of that, and maybe where people can find more information?
Yes. The protocol is not complicated. It's being posted on the American Academy of Periodontology Society. So your dentist can find it everywhere. And but first step is to remove the infection. This is the first thing. Understand the disease. Second step would be remove the remnant of the disease, which would be a calculus inside the gum. And then the third step is make sure everything is cicatrization. I don't know what I would say in English. It's like tissue go back again together. Okay, so it takes 4 months, 5 months, and then appropriate things to do so you don't get this disease back again. So if dentists want to, if some patient want to go to their dentist, I understand their dentist doesn't know about this protocol. So what we have done is create this International Institute of Periodontology and this internet parodontit.com, so that you can find somewhere where I teach. And we are more than 1,000 dentists actually now doing this protocol. And what I would encourage is saying to the patient, ask your dentist. Some dentists have microscope. It starts a little easier, okay? And just having to come to our seminar so they learn. It's really it's a big thing to learn. It's 5-day seminars, and sometimes you have to do 10-day seminar, so you get used to it. It's very rigorous protocol, but it does work. Patients are cured. Patients are better. Gum close, no more bleeding, no more parasite, no more inflammation into the gum. We just see it. And it is, I don't know how to say, teachable. But you have to have your dentist curious about this. And this is why I made this book, To Kiss or Not to Kiss. Or in French, it's Tant de bouche à guérir. So it's because I want people understand that there is a solution to periodontal disease, gum disease. There is a solution, but you have to ask your dentist that he learns this way, this protocol, to have so good results. We've published many good results, like 700 patient cured. I mean, it's more 95% our patient are cured. So it's incredibly reasonable that we can adapt this to Hashimoto. I've looked a little bit of Hashimoto's bone destruction I've seen, and I couldn't believe it. I mean, a lot of bone destruction, and I'm sure this correlates again with the parasites, mostly Entamoeba, which it's a real predator. It really nourishes from red and white cell. It's absolutely incredible to leave this parasite into that kind of disease, and it's so easy to do this microscope examination. So why not? So what do I have to lose? Absolutely nothing. Just positive thing could happen as cure the disease. And I hope having best result with this Hashimoto thyroiditis.
That's a really great point. My suggestion for anybody with Hashimoto's and bleeding gums, so if you're brushing your teeth, you're flossing your teeth, and you're seeing bleeding gums, is to see, a dentist like Dr. Bronner or somebody that's been trained by him, get the microscope evaluation to see if you have these parasites that are living inside of your gums and causing inflammation, not just in your mouth, but potentially in the rest of your body, leading to, other potentially Hashimoto's as well as other autoimmune conditions. And to get your thyroid antibodies tested before you go through the protocol and then after the protocol. And, let us know what your results were, because I'm willing to bet that treating periodontitis with your protocol is going to help, reduce thyroid antibodies as well.
I just believe it can be helpful. And, we start in the USA now, but in France, like this, we have, we call in French, it's called a réseau. It's, many dentists within the country, France, and any patient calling at our institute, they ask, where do I find a dentist in France? And then we give the answer because we are so many there in France. But actually, like I start with this next meeting next Friday, and dentists from Texas, Los Angeles, Miami, California. So if we can create this in US country, I believe it could be really, really, really different for patients, and find a group, find a dentist. Actually, you might have to go a little far away from home, but I hope in the next years we have more dentists doing this protocol with much success. We hope, yes.
So everybody go to your dentist and tell them about Dr. Bronner's work and tell them to sign up for his training program.
That's the only way I can. I love to give those seminars, and I know how to do it, but I don't know any other way. Of course, you can learn a little bit with the book, and I hope next year we have this book for the dentist. But you have to have to be involved into a practical treatment. When you're dentist, you have to know how to work with your hands, with the microscope and with the microbes, so you don't do errors and things like this. So I have somewhere to be involved into this. It's with great pleasure. I like to make things go better, because I know it does give good to patients. It's a good solution for periodontal disease, and I hope Hashimoto is the same way.
So Dr. Brown, anything else that you'd like to add and you think people should know about periodontitis or your work?
Rita, I just want to say that you have to consider you have an infection and ask your dentist to look at it. This is the most important thing. And those parasites you find into your gum, those are not normal. Those are not common cells. Those are not natural bugs that you have. It really is an infection, and do not keep those parasites. It's no good for you. Absolutely. It's a specific infection. We could call this periodontal disease like amoebias, oral amoebias, or trichomonias oral. It could be right, because this is specific infection, and don't keep this. It's no good. It's no good. Just get cured. Just get this out of your body.
Mm-hmm. Yeah, I think I've seen some studies that looked at, or just when you look at the CDC website, it'll say that it's commensal. So they're trying to say it's normal, but it's not.
It is not commensal, because I've looked at so many thousands of, patient, normal patient, adult, children. You look at them, they do not have those parasites. Mm-hmm. The correlation is 100%. Wow. And most, research things try to say it's smoking, it's genes, smoking, it's stress. I think it's the reverse. I mean, really, it is an infection, and don't keep this. I mean, it's important. It really is important. But ask your dentist for this microscope thing. So they have to look at it, and they have to have a correct microscope. The thing I explained to the dentist is you have to have a hospital grade microscope. I mean, it's not little microscope you find in the, cereal box. It has to be a real sophisticated microscope. It is affordable for any dentist, but it has to be just like in the hospital, the parasitologist or the doctors looking at the cells. So it has to be a hospital grade microscope, just to make sure you really can see the things. And I haven't talked about it, but maybe you can find, I have plenty of film and movies of this on YouTube on my name. If you look at YouTube and Marc Bonner, you find many things, many speech, many things that we have done about this for years. So this can be found on any YouTube at my name. So you can learn more.
Yeah, thank you so much for that. And, I kind of think about this like the H. pylori infection. So for a while, there was this big controversy, and they were looking at what was causing ulcers. And all the top ulcer doctors were saying, like, let's do this surgery to fix ulcers. Now, this is the latest surgical method. And these two guys came out and said, no, we think it's a bacteria. And they were ridiculed. They were laughed at. They said, there's no way a bacteria could live in the stomach that could cause ulcers. You guys are crazy. And so eventually these guys actually infected themselves. That's how some of the innovation happens. And they were able to find out that, sure enough, H. pylori caused ulcers. And then curing it cured the ulcers. And now that's well known.
Yeah, but it is exactly the same story for periodontal disease. But it's not bacteria, but it's parasite. It's the same story. And what is the easy thing is, you don't have to get into the gut down there to see what happened. It's just taking from the gum. So it's so easy to do. And I forgot what I wanted to say about
I think you were going to say about like what big differences you see in people where they'll have all of these digestive problems and they'll have joint pain.
Yes, so many patients I've seen gut problem, digestive problem go away, fatigue go away, arthritic problems go away. It's very a lot of improvement in many diseases. So yes, I think it's like Helicobacter pylori, but the only thing is, first I wanted to be infected myself, but really I can't. I can't do this. So I refuse, because we could do the same thing. But what we are at now actually is having, in fact, universities doing my protocol, this protocol, anti-parasitic protocol versus usual protocol, and see the difference. So this year we have some universities starting doing this comparative result, and doing this we can be now in the usual research teams, and then it will make the difference. It's about the same story as Helicobacter pylori, just doing the studies comparative, and then there's no, the healing is really feasible. for the disease.
Wow. That's amazing. I'm just so excited about the work that you're doing, and just, such an honor for me to speak with you. Thank you.
It's a pleasure really to participate. Okay. So
Okay.
thank you very much, Izabella.
I want to thank you for the work that you're doing in the world. I was just so excited to find out about you and your work, and just such an honor to have you here. And thank you for sharing your innovation with us.
For me, it's a pleasure, and it's just an ethic thing, because as I know we can cure this disease, it's obligation I have to communicate about this wonderful positive action we can have on this disease. So it's always a pleasure for me to participate into this.
And so for our recommendations for patients, check out Dr. Bronner's book, To Kiss or Not to Kiss. You can buy that on Amazon. And then for dentists and definitely patients, to check out Periodontitis.com. It's Parodontiite.com. So thank you so much again for the work that you're doing, and thank you so much for joining us. I'm just really, really excited to get this information out there. I know it's going to help so many people with gum disease, with periodontitis, as well as with Hashimoto's.
It's a great pleasure for me to participate, and I've been very glad to meet people like you, pharmacists, doing all this work, and congratulations, it is very good. So I hope we can do a lot for the benefit of health, and have patients feel better in their entire body. So it's really nice you invited me to this conference.
Mm-hmm. And my pleasure, absolutely. Well, everybody, thank you so much for dialing in. I hope you all have a great day, and that you found this interview helpful.